Hello friends, I am Dr. Sarthak and I practice in Narayana Health City, Bangalore. Today we are here to discuss about an important topic, one which affects all of us, each and every one of us at some point of time in our life. So we will be discussing about hypertension and how to prevent or control hypertension. Hypertension is basically the force or the excessive force which is required to pump the blood through the blood vessels of the body. Hypertension, as we know, uh, it affects each and every one of us. In fact, at certain point of life, as we grow older and older, it starts affecting us. Hypertension is basically the forceful pumping of blood through the blood vessels of the body, forceful enough to cause damage to different organs of the body. And statistics have shown that as a person grows older, for every decade of the increase of the age of a person, there will be 10 millimeter mercury increase in the blood pressure of the person. So that basically shows us that every person, if a person lives up to the age of 100, there is a definite chance that he or she will become hypertensive. So that's how hypertension is prevalent in the society, and that's how it is going to be prevalent as we grow older. As more and more people grow older, they live to be old, more and more hypertensives will be there in the society. There are certain irreversible factors which lead to hypertension, and there are certain reversible factors which lead to hypertension. What are the irreversible factors? Age. Age, as I informed. So age is the first irreversible factor. Everybody grows old, and as you grow older, there is a higher possibility that you will become hypertensive. Second, sex. The male sex is having a higher tendency to become hypertensive, particularly till the time where a woman attains menopause. Around the time of menopause and post-menopause, males and females have similar tendencies to become hypertensive. Then family history. So if your parents are hypertensive, you have a higher chance of becoming hypertensive. So those are the factors which cannot actually be changed, or which a person cannot affect by any intervention or any any changes in whatever lifestyle they lead. There are certain reversible factors which lead to systemic hypertension. So what are these factors? One is your diet. If you are prone to eating too much of salty food, or too much of processed fatty food, then the chances of you becoming hypertensive at a younger age is much more. Unhealthy lifestyle, that is a lot of sedentary lifestyle. Most of the time, if somebody is sitting, not moving around, or if your occupation is demanding that you just sit at a single place for hours and hours together, the chances of you becoming hypertensive is much more compared to that of another person who is having an active lifestyle. Then the next part, which is very, very important, is stress, or rather how you handle the stress that you get in your life. So those who are unable to handle the stress adequately, they tend to become hypertensive pretty soon. And this can affect even people who are much younger, like let's say somebody in their 20s or 30s, even they can become hypertensive because of this. Additionally, lack of adequate sleep, or lack of restful sleep, or improper biorhythm can lead to hypertensive state at a much younger age. So how do we manage hypertension? If let's say you are not yet hypertensive, then you come in the category wherein we will describe to you the primary prevention methods of avoiding, that is basically how to not keep you, or how to postpone the incidence of hypertension in you for a longer and longer period. The steps are quite simple. Number one, have enough exercise in your life. That is, we advise, we physicians, doctors, we mostly advise something like around 40 minutes to 60 minutes of moderate to high intensity exercise on a daily basis, every day, or at least 5 days out of 7 days in a week. Then next thing, avoid fatty food, or avoid eating high quantities of fatty food or processed food, because the salt content, the triglyceride content, the bad cholesterol in them will be much more high, which will lead you to having hypertension at an early age. Next, control your diabetes, that is important. Next, have adequate sleep in your life, get sufficient sleep on a daily basis in your life, and that sleep should be complete deep sleep, restful sleep. Cut down on obesity. If you are obese, it's time for you to start jogging, exercising, doing whatever is feasible, whatever is important to bring down the obesity levels, because that will help you reduce the chances of having hypertension. And reducing the salt intake. Now, what happens to you if, let's say, you are already hypertensive, or the blood pressure measurement at a neighboring clinic shows that your BP is more. Now, what is more and what is less? So, I'll come to that point first. The normal blood pressure, whatever is given in the standard textbook, it says that 120/80 millimeter mercury blood pressure is it's normal. In actual practice, a range of blood pressure in which the upper value, the systolic blood pressure, can be from 110 systolic to 130 systolic, and the lower range from 70 to, let's say, 85. So anything between 110 to 130 in the upper value, and the lowercase value, anything between 70 to 85 can be considered normotensive. That means somebody getting anything of that is normal. As you cross 130/85, you gradually are going towards the direction of becoming hypertensive. And if somebody's BP is crossing 140/90, they definitely need urgent early medical attention to prevent damage to the organs of the body. Various organs of the body, all the organs of the body will be affected by the hypertension, slowly, silently, over a period of time. So, how do you manage hypertension if you are already hypertensive? So that comes in the ambit of secondary prevention. That means basically you are already hypertensive and you are managing. How do we do that? How do we go about doing it? So number one, again, regular exercise, around 40 to 60 minutes of exercise on a daily basis. Good healthy diet, which should include lots of green leafy vegetables, as less amount of salt as possible, as less amount of processed food as possible, trying to cut down on your intake of red meat. So these are the measures. Basically try avoiding deep fried food. Next part is reducing obesity. Now if you are obese, that is your BMI levels is anywhere above 24.5 and beyond. So if you are obese, even if you are not hypertensive today, you will become hypertensive over the next 1 year, 2 years time. Why? Because if you are obese, the quality of sleep that you get in your life is going to get affected. You will snore more, the sleep quality will be less, you will not wake up fresh, and over a period of time it's going to cause physical changes in your body, and it's going to cause hypertension. The next part is avoiding or managing basically stress in life. Wherever possible, avoid stress. If not possible, understand how to manage stress by go into yoga, meditation, whatever works for you. Third, and then the last part, once your physician advises you to take certain medications, please continue to take them regularly on a daily basis without fail. And if you are feeling that there is a need to change some medications, or you are not feeling comfortable with it, do not stop the medicines by yourselves. Rather, visit your physician, discuss your problem with him or her, and get a proper solution to it, which is definitely going to help you in a long run in controlling hypertension and its side effects. Thank you.